I'm sure you've all seen posts about Helping Hands, an initiative that seeks to connect struggling Muslim youth to peers that are able to support them to access resources. However, many of you probably have some questions about where this idea all started in the first place. Well, Helping Hands actually takes its inspiration from another evidence-based intervention called the Friendship Bench Project. This is a project that has broken down barriers and made talk therapy accessible to many. The Friendship Bench started from humble beginnings. The project was originally developed in Zimbabwe by psychiatrist Dr. Dixon Chibanda in 2006, and the mission of this project was simple. It was to improve the quality of life and mental well-being of the community. The story of its conceptualization began when Dr. Chibanda received a call from the emergency room from a city about 200 kilometers away from where he works. His patient, Erica, who he had treated months before, was admitted to hospital due to an attempt to end her life. The treating doctor, Dr. Chibanda, and Erica's mother came up with a plan. As soon as Erica was released from hospital, they'd visit Dr. Chibanda's clinic to undergo a psychiatric evaluation. But things don't always work out how it's planned. 3 weeks had passed, and Dr. Chibanda still had not heard back from Erica's mother. Eventually, he received a call informing him that Erica had died by suicide 3 days earlier. When Erica's mother was asked for the reason for not visiting Dr. Chibanda as planned, her response was brief but informative. They did not have money for the bus fare to travel to see him. The incident struck a chord with Dr. Chibanda. Why were people being deprived of basic mental health care purely due to a lack of access? In this case, a bus ticket could have been the difference between life and death. From there, he worked tirelessly, training up some of the most reliable and valuable people within their community, grandmothers. These grandmothers were trained in evidence-based talk therapy and became the first point of contact for many seeking help. They would sit on a bench in the town and assist those who needed help, and the rest is history. Helping Hands has adapted this remarkable approach and seeks to apply this within our own community of Muslim youth. Help givers will be trained and made available to aid help seekers across different areas in Melbourne, much like the Friendship Bench in the village. As Erica's story taught us, accessibility is everything. For more information on the original Friendship Bench intervention, check out our website for the resources.